At Novartis, I'm really proud to say we're one of the biggest collaborators with the NHS when we look at collaborative workings. We partner across all 4 of the nations, from primary through to secondary care. And last year, in 2023, we actually had ongoing over 100 different collaborative working projects, which we believe to have impacted over 50,000 patients within that term.
Welcome everyone. I'm here with Helen from our team, and we're going to be talking about the importance of collaboration in improving patient outcomes.
So my name is Helen Fotheringham, and I lead the Solutions and Service Design team here at Novartis UK. We like to think of ourselves as a bridge team. So we're a bridge out to our field colleagues into our internal Novartis colleagues, so we can ensure that the projects that we build are compliant, are managed appropriately, and are really fit for purpose to improve the healthcare system.
It'd be wonderful to hear from you. Recently there was NHS Confed meeting at which ABPI and the NHS Confed announced new guidelines around how to do these collaborations and agreements. Maybe you can give us some headlines and what does it mean for you and your team?
This piece of guidance documentation is a really great tool in our arsenal. Collaborative workings are, guided by the ABPI. This really gives further information and clarity on how to build projects, how to work effectively in industry and NHS partnerships, and really can demystify how these projects can be set up, built, delivered and deployed.
Because what I've seen over the last few years is certainly an improvement in terms of openness and trust to say, actually, we do have the same objective, which is improving patient outcomes. So it is the right thing to do to work together.
The wonderful thing specifically about collaboration and collaborative working is there's a triple win. A triple win in the fact that the industry can have a benefit, the pharmaceutical industry can have a benefit. The NHS, of course, will have a benefit. We are building these collaborative workings to benefit the system, to pilot an innovative new way of working that will improve the system, improve ways of working for the people who work within the NHS. And finally, of course, the patients. These projects, really, most of them have a huge aim to improve patient pathways, increase the equity of care, and improve patient outcomes.
And you've talked about doing pilots. What is your reflection on moving to pilot to sustainable solution? Because what we want is to make sure that that impact can last from the pilot and beyond.
We aim to collect data, impact data, that can really show the change that these projects are having within the system. We build all of our projects here in Novartis, and collaborative workings in general should be built like this, with that sustainable change in mind at the end. I'm really proud of the work we do at Novartis, and in general the work industry does to partner with the NHS to really create this sustainable change and have that patient impact. It's amazing, I think.
Any key message or actions that you would like to even continue to further increase these collaborative working?
Great thing about these collaborative working partnerships is the resource pooling. So you've got, obviously the NHS have the expertise, they are on the ground, they know what their patients need, they know what their services need. But industry can also bring a lot of additional expertise from their knowledge across the healthcare systems within the UK, with their ability to project manage, to look at impact data, to look at the project as a whole. So I think this pooling of resources can really build new ways of working and can build in digital and AI where it needs to be in these projects.
Because I think the message for everyone as well is, the way to improve for us from the UK patient outcomes to address health inequality, etc., is really to work together as one. So the system, the industry, really working together on that focus, on that common goal. And as you said, I think the guidelines are really something that will help us do that even more transparently. So I'm hoping that the number of patients we impact as Novartis, but as an industry as a whole, will then increase with time. Wonderful to have you, Helen. So thank you for joining me, and please continue the great work that you're doing for patients.